I'm a genetic counselor by background. I'm on the faculty at Emory University School of Medicine in their Department of Human Genetics, where I teach and mentor for the Masters in Genetic Counseling program. And in addition to that, as part of my job at Emory, serve as executive director of the J-Screen program, which provides national at-home access to carrier screening and genetic counseling services. Genetic screening is DNA testing that's used to determine a person's risk for having a genetic disease or their risk for having a child with a genetic disease. Carrier screening is testing that's done to determine potential risk to a person or a couple's future kids. When we say equitable carrier screening, that's making sure that everybody, regardless of their background, has access to comprehensive and accurate testing to understand their risks of passing on genetic diseases to their kids. I've been a genetic counselor for many, many years. We are healthcare professionals who work with people and families to help them understand how genetic information could impact their life. Genetic counselors talk to patients prior to pregnancy or during pregnancy. They're alerting people to their risks related to their medical history, their family history, and they're discussing available testing to help people plan ahead, whatever situation they're in. I will say that carrier screening is really ideally done prior to pregnancy. And the reason for that is if a person knows what their risks are for having a child affected with a genetic disease, it's giving that individual, that couple, more options to plan ahead. That said, you can also do genetic counseling during pregnancy to talk about available testing even at that point. So the purpose of genetic counseling in those contexts is to sit down with that individual or couple, to go over their family history, to go over their medical history, to explain testing that's available, how is that testing done, what are the implications of testing, and potentially what might you be able to do with that information. Then after any testing is done, that genetic counseling is also critically important to explain the results and what the next steps might be that are pertinent to that couple and their family planning.